Good day, everyone. This presentation discusses the transition from ICD-10 to ICD-11 based on a comparative analysis of these classification systems. The International Classification of Diseases, developed by the World Health Organization, is a globally recognized system used to classify diseases, disorders, injuries, and other conditions. It supports clinical documentation, epidemiology, health management, and reimbursement systems. The definition of ICD. The, the definition of ICD is International Classification of Diseases. It was developed by the World Health Organization and it is used to classify diseases, disorders, injuries, and such. It also supports clinical documentation, health statistics, and healthcare systems. The ICD system serves several essential purposes. First is the standardization of disease classification across the country. Second is the collection and comparison of global health statistics. Third is the support of local clinical decision-making and healthcare planning. And lastly, the facilitation of insurance and reimbursement processes. ICD-10 has been widely used for decades. However, it has limitations that prompted the development of ICD-11. The limitations for ICD-10. The article identifies several limitations to ICD-10. First is a rigid and static structure. Next is a limited capacity for incorporating new diseases. Third is a lack of digital optimization. And lastly, it is insufficient specificity in coding complex conditions. These limitations both affect clinical accuracy and data quality. Next, we have the structural comparison between ICD-11 and ICD-10. So the number of chapters in ICD-10 is 22, meanwhile in ICD-11 it is 28. The structure type of ICD-10 is hierarchical and rigid, meanwhile ICD-11 is flexible and layered. The update mechanism for ICD-10 is periodic revisions, and in contrast, ICD-11 has continuous updates. As for the design, ICD-10 is paper-based origin, meanwhile ICD-11 prioritizes a digital-first system. ICD-11 introduces a more flexible foundation that allows easier expansion and modification. Next, we have the coding system and architecture. One of the most significant innovations is the coding system. For ICD-10, the coding type is pre-coordinated. Meanwhile, for ICD-11, it is pre- and post-coordinated. For ICD-10, the detail level is limited. Meanwhile, for ICD-11, it is highly detailed. And the flexibility of ICD-10 is low, meanwhile ICD-11 is high. In ICD-11, post-coordination allows multiple codes to be combined to describe severity, anatomical location, associated conditions, and etiology. This provides a more comprehensive clinical picture. Next, we have the foundation component and linearization. The article highlights the concept of a foundation component in ICD-11. It is a comprehensive database of all diseases and health conditions. From this specific linearization, it is derived for different uses such as mortality and morbidity statistics. This is a major conceptual shift from ICD-10, which relied on a single hierarchical classification.
Now for data integration. ICD-11 is fully integrated into digital health systems. Here is a table of digital features. Electronic integration is limited for ICD-10, while fully integrated for ICD-11. For online tools, there are minimal options for ICD-10, while there are more available options for ICD-11. In terms of API support, there are none for ICD-10, while there is for ICD-11. And finally, for AHR compatibility, it is limited for ICD-10, while high for ICD-11. This enables real-time coding improved interoperability, and better data exchange across systems. Content expansion and updates. ICD 11 includes substantial updates in disease classification, inclusion of new diseases and conditions, updated diagnostic criteria, and removal of outdated terminology. This system is also designed for continuous updates, ensuring long-term relevance. Code structure format. The structure of codes has also evolved. ICD-10 codes are mostly numeric with limited extensions. ICD-11, however, uses alphanumeric structure with greater scalability. This allows more combinations, better categorization, and increased specificity. Clinical applications. The improved specificity of ICD-11 enhances clinical practice by allowing more accurate diagnoses, supporting individualized patient care, and improving communication among healthcare providers. Public health and research. ICD-11 significantly improves data quality for research and public health. Benefits include more accurate epidemiological tracking, better data monitoring for disease trends, enhanced comparability of international data. This supports evidence-based policymaking. And of course, there are implementation challenges. The article also identifies several challenges, that being training of healthcare professionals can often take time, transitioning from ICD-10 systems can often take time and also resources, and of course, financial and technological costs. These challenges are particularly relevant in resource-limited settings. Finally, and most importantly, the advantages of ICD-11 over ICD-10. Here's a table summary of those advantages. For accuracy, it has a higher diagnostic precision. For flexibility, it has an adaptable coding system. For technology-wise, it is fully integrated digitally. For global use, it is multilingual and standardized. And finally, for updates, it has a continuous revision capability.
So, in conclusion, ICD-11 represents a transformative advancement in disease classification. Compared to ICD-10, it provides greater detail and flexibility, improved integration with modern technology, and enhanced support for clinical care and research. Despite implementation challenges, ICD-11 is expected to significantly improve global health data and patient outcomes. That is all for today's presentation. Thank you for your attention.